Hi, I'm Alex Levin. I'm the Chief of Pediatric Ophthalmology Ocular Genetics at the Philanthropy Institute and the Chief of Clinical Genetics at the University of Rochester Medical Center. This is the first time I've been at a CRF conference, although I've listened in on the webinars, so on and so forth. But with the pandemic and all, it's good to be back together and meet and attend the meeting. I, as an ocular geneticist, see a lot of patients for 30 years with choroideremia, and I've been following and listening in on the Choroideremia Research Foundation and the wonderful work that's being done, and the opportunity to have this conference in our city is the reason I'm here, to join up in person and meet people and be available to help in any way I can. My takeaway for this kind of meeting is this is a great opportunity to achieve three things. One, for like-minded people to meet each other. You know, a person with choroideremia knows what it's like to have choroideremia. And most people with this rare disorder have never even heard of it, don't know anyone else who's got it. There's no one that lives on your block that has it for sure. And this is an opportunity to get together and not only share your story, but to share your experience. What have you gone through? What things have worked for you? What are your questions? The second opportunity here is to look to the future. How can we work together to come to a cure for this disease, both in the form of fundraising, supporting programs, and finding your own way through the clinical trial morass of things that are becoming available. How do you know what you should be doing or what you can do right now? And lastly, the third thing is to come and learn. There's a lot of professionals here with a lot of experience in the disorder, and it's an opportunity for us to talk to each other and learn from each other, but for you, the patients and the families, to learn as well. You're not going to get a more expert group of people. You're not going to get a more hands-on opportunity to learn about the disorder in a focused way than you will right here. Philanthropy is so critical to the mission of a foundation like this and to the diagnosis and treatment of rare disorders in general. You know, we hear about runs for breast cancer all the time. Obviously very important, but much more common. And that's why we hear so much about it. We hear so much about autism. We hear so much about the more common disorders. And it's tough for the rare disorder because it costs just as much to treat choroideremia as it does to treat these other disorders that are more common. So how do we get a focus where we can develop the pool of money it takes to diagnose and develop treatment for a rare disorder? And sometimes it comes down to families and patients and like-minded individuals getting together to make it happen. In our program at the University of Rochester, for example, all of our patients who have retinal problems like choroideremia have free genetic testing and are part of a research program to develop new gene therapies for many of those disorders, retinitis pigmentosa and others. It's all free because we are completely philanthropically funded. And that shows you the power of philanthropy. I can have any patient tested for no cost with our partners at the University of Iowa. It's amazing what can be achieved, and there's plenty of money in the world to achieve it. It's just a matter of calling attention to a particular problem, finding the interested individual, and working together to make that happen. There's a myth out there, and the myth is that, oh, someone else is going to fund. The government is going to fund. NIH is going to fund. National Alliance is going to fund. Foundation funding Black. It doesn't work that way. The only way to get the money, and we're talking millions of dollars, to make something happen for a disease like choroideremia, is to go out and get private funding. Yes, industry funding is helpful. That comes with the ties and the strings attached, and there's a penalty in some way for that. Ultimately, finding interested individuals and getting private support makes a world of difference. And then people say, oh, I can't afford it. I can't. You know, a dollar is important. And when you think about how we spend our money in today's world on frivolous things, you can make a real difference, just reaching in a little bit, finding those people, and you never know who has money. We all know stories about the woman who died that had $10 million and 50 cats. Well, those are real people, and finding those kind of people may make a difference. It may be you.